to grow my family. This is something that was very important to me. I had gotten married. We got pregnant right away. We were very excited. It was a regular delivery. Pretty quickly after that, we got pregnant again. I had a 20-week loss. The doctors told me that I had something called cervical incompetence.
Cervical insufficiency is when a patient is pregnant and due to a number of factors, there's something that has caused a weakness in the cervix. One of the early common signs is something called funneling of the cervix. And it's when the upper part of the cervix actually goes like that due to the weight and starts showing changes and more pressure. Ultimately, it will lead to the patient going into preterm labor, delivering, or losing the pregnancy altogether.
The doctors told me that I'm going to need something called a cervical cerclage. The next year, I got pregnant again. At 20 weeks again, my water broke, even though I had that cervical cerclage. Unfortunately, that baby didn't make it, so that was another very early loss. My doctor, he said that there's only one other possibility, abdominal cerclage with Dr. Nimaroff.
For some patients, we fortunately today have an option of placing the suture abdominally higher up on the cervix. Even those who have failed other treatments for cervical insufficiency still very often can have a good outcome and a successful pregnancy with the abdominal cerclage. The success rate of abdominal cerclage is 85 to 90%. We can do many of these procedures, and most of them through a laparoscopic, and at times some choose to do it through a robotic approach. Doing it laparoscopically, going through small incisions in the abdomen and using special cameras offers patients a quicker recovery. And even when we do place them on occasions during pregnancy, we can even do that same laparoscopic treatment as well. Patients who have an abdominal cerclage, generally speaking, all have cesarean sections for their delivery. This way we're able to leave the stitch. We don't remove it at the time of the delivery, and the patient can get pregnant again. The patient can have multiple pregnancies. Symptoms of cervical incompetence include increased vaginal discharge, bleeding, and mild cramping. It's a small subset of patients who have this particular issue and need this particular treatment. With Northwell's pregnancy loss program, they come to a site where this unique issue isn't unique, and that's the difference. Helping patients who have such a struggle in their lives to have a family, really it's changed my life. I got interested in this particular field of medicine when my wife and I had similar problems. We unfortunately had 4 losses before we were able to have our family. To be able to offer a procedure that really changes lives, it's my favorite thing that I do. I have doctors all over who send me the ultrasound pictures of my stitch, while they're being scanned throughout the pregnancy. My favorite is the pictures from the deliveries. There's nothing better.
Dr. Nimaroff, because of him, I was able to go full term with my very adorable daughter. I couldn't thank Dr. Nimaroff enough. It's really a miracle. Anyone who is in my position, definitely recommend the abdominal cerclage. Please do it. And with Dr. Nimaroff too.